A cesarean section, while sometimes necessary, carries distinct risks for both mother and baby. Maternal complications can include infections, bleeding, or anesthesia reactions, while future pregnancies may encounter issues like placenta previa. For the newborn, risks can involve respiratory problems or even surgical injuries. Before opting for a C-section, it's vital to consult with a healthcare provider to understand the associated risks and recovery implications. A cesarean section, C-section, is a surgical procedure used to deliver a baby through incisions in the abdomen and uterus. While it's a relatively common and often necessary procedure, it does carry potential complications for both the mother and the baby. Here's a breakdown of those complications. Maternal complications, infection. This can occur in the incision site, uterus, endometritis, or urinary tract. Bleeding. Excessive blood loss during or after surgery is a risk. Blood clots. C-sections increase the risk of deep vein thrombosis, DVT, and pulmonary embolism, PE. Reactions to anesthesia. Like any surgery, there are risks associated with anesthesia. Injury to other organs. There's a small risk of damage to the bladder or bowel during the procedure. Scar tissue, adhesions. Scar tissue can form inside the abdomen, potentially causing pain or complications in future pregnancies. Complications in future pregnancies. These can include placenta previa, placenta covering the cervix, placenta accreta, placenta growing too deeply into the uterine wall, uterine rupture, tearing of the uterus, emotional difficulties. Some women experience emotional distress following a C-section, fetal complications, respiratory problems. Babies born by C-section, especially if performed before 39 weeks, may have a higher risk of transient tachypnea of the newborn, TTN, a breathing difficulty. Surgical injury. Although rare, there's a small risk of the baby being accidentally cut during the surgery. Important considerations. The risks of C-sections vary depending on individual circumstances and the reason for the procedure. It's crucial to discuss the risks and benefits of a C-section with your healthcare provider. Recovery from a C-section generally takes longer than a vaginal birth. It is important to remember that C-sections are often performed when they are the safest option for mother and baby.